This is Dr. George Stanley from University Diagnostic Institute here in Orlando. Years ago, I was in the gym during the morning hours and was doing bench pressing, and all of a sudden, I felt a pop in my shoulder. The pain was pretty bad at the time, and I knew something was really wrong. So I was able to drive down the street to my radiology center, and it just so happened that one of the patients was late, and I was able to jump on the MRI machine and figure out what was going on. So I told the technologist that I just need a quick scan. I just need to figure out if I had major damage in my shoulder after the incident at the gym. So I did get on the MRI machine. Of course, the technologist was very, very helpful, got me in right away, got the scan done, came out of the scanner, and I took a look at the images myself, and within 5 minutes, um, I was able to diagnose that I had a partial thickness rotator cuff tear, but not a full thickness tear. I didn't need surgery, and I rehabbed the shoulder and got back to my normal routine shortly after. But it was very, very helpful to have that peace of mind after getting an injury like that. I was really into working out and weightlifting, and that's something that was in the forefront of my mind. Is is this injury going to stop me from doing what I love to do? And I was really, really thankful that I have an MRI center. I was able to get in and get the diagnosis right away. So when I got the injury initially, there was a sharp pain in my shoulder, and I felt my shoulder stiffen and became swollen, and I knew that the motion of my shoulder, the range of motion of my shoulder was significantly decreased. So I had a feeling that something was really wrong, and the fact that there was initial failure of the shoulder following the injury as far as the bench press was concerned, I knew that there was something that was potentially serious. So that's what's prompted me of getting the MRI. It wasn't like it was a life-threatening emergency or anything like that, but it was something that I knew could threaten my progress in the gym or stop me from doing something I like to do. So it was concerning enough that I wanted to find out what was wrong as soon as possible because um, when when it comes to matters like that, the longer you wait to see somebody to get it fixed, the more time you're out of what you love to do. And so, with the combination of the pain, the discomfort, the decreased range of motion, and the fact that it was a potential loss of something I really like to do, it prompted me to get the MRI right away. The the type of imaging I got from my shoulder was an MRI, which took about 15 to 20 minutes to finish and results immediately after. And I was able to diagnose myself with a partial thickness rotator cuff tear. So and by the time I hit the door at UDI, it was probably less than a half hour before I knew the final results. Over the years, thinking about that incident and that event prompted me to want to give that opportunity to the average person, and that's how USCAN was um, developed. Okay. I was able to get an MRI right after the injury because I own the radiology center, and I could have access to that machine at any time. Obviously, if there's patients on the machine, I couldn't, but in between patients, I would have time to hop on the machine and have myself scanned. And the reason why I started USCAN is I wanted to make that a possibility for the average person that doesn't own an MRI, the average person that's not a radiologist can find out what's wrong with their shoulder or any other part of their body from an injury right away. And with USCAN, you can book a scan the same day, come in, get the scan done and get the results right away. And that's kind of what I wanted to promote. I wanted to give to the population at large, or the average person, the same access and ability to get what I can do, because their passions, their hobbies are just as important to them as mine was to me. And I can see a lot of anxiety, or a lot of struggles. It could also be something like, if you're a worker and you hurt yourself, or you can be out of work for a while. You want to know right away what's wrong. I mean, that could be another thing that can cause anxiety. And the purpose of USCAN is to get you to um, the right radiology center, and the right radiologist who will uh, will consider that your time is valuable, and time is a factor in all this stuff, and get you in and out of the machine and with the results as quickly as possible, so you can take the next step into your recovery. So to book your next day or same day scan, you'd go to uscantoday.com, follow the prompts, sign up for the scan. You have a selection of scans, and go to the custom scan, click on that, fill out the information, and someone will contact you and set you up for the scan. If you want the scan the same day, you'll get the scan the same day. So after the injury diagnosis and then the physical therapy, I was back in the gym, pain-free within 2 months, and I was very appreciative to have the opportunity to diagnose my injury that quickly, so I can get on the road to recovery as quickly as 2 months. I hate to think about if I had to wait 1 or 2 months just to get the diagnosis, how long that would have played out and extended the time between the initial injury and the time to get back into the gym. But knowing the diagnosis the same day certainly sped up that whole procedure, which allowed me to get back into the gym as fast as possible. The takeaway from being the patient in this is the fact that you're basically, when you're injured or sick, you're at the mercy of other people, and can only go as fast in your recovery as other people will allow you to do. In other words, you can only book your doctor's appointments or your scans when there are openings, or when the doctor's able to see you. But with USCAN, you can take that power yourself, and you could take the control of your health and get your scan the same day. So it's a big difference from what we think of conventional medicine is, where basically, call a doctor's office and wait 3 or 4 weeks to see a doctor. Here you can, if you want to be seen the same day to get your scan, you can be seen the same day. There's no reason to wait for anything anymore. Just go to uscantoday.com, sign up, and get your scan. And as a radiologist, from that point of view, it's basically the ability to number one, get the scan done for somebody, and number two, being able to look at it and make the diagnosis, and kind of let somebody know basically what's going on with their shoulder, and in greater detail with what part of their shoulder is injured, and hopefully send to a specialist. In this case, would be an orthopedic surgeon, as quickly as possible. Thanks for watching. This is Dr. George Stanley from University Diagnostic Institute. If you want to see additional information concerning radiology and medicine in general, like and subscribe to our YouTube channel.